Good afternoon, Dr. Eric Legzinski here at Fanwin Back Relief Center. Today we're going to talk about managing an arthritic shoulder. While the shoulder is composed of 4 joints, it's the ball and socket, the glenohumeral joint, that plays the most important role when regards to wider range of motion of the upper arm. However, because it has more range of motion, it also has the least stability, which causes a common source of injury at the ball and socket joint. Sometimes these injuries occur suddenly, falls, traumas, accidents, but more commonly it's more like repetitive stress that causes the pain and disability, that causes a patient to come to my office with shoulder pain. So things like excessive vibration, overuse from using your hands overhead continuously, heavy lifting. This all builds up over time and causes inflammation in the joint, and also can place a lot of stress on the hyaline cartilage that covers the bones and reduces the friction during its range of motion. The erosion of this cartilage, what causes the joint to eventually deteriorate, and we call this osteoarthritis. In fact, 30% of adults over the age of 60 develop arthritis in the ball and socket glenohumeral joint. So the most important factor in this is a lot of people leave this untreated. They get pain in the shoulder, maybe they take a few Advil or they put ice on the area, and they never really address the problem. I can tell you from experience that the sooner, when you experience pain, the sooner you can get in to myself, physical therapist, orthopedic doctor, to get it evaluated and treated properly, the better the outcome is going to be. It's usually the chronic injury, the micro trauma to the joint that over time leads to this osteoarthritis. So when a patient comes to my office, there's several different ways in which we address this. We use manipulation, mobilization, soft tissue therapy of the shoulder, the chest, the back, the neck. All that stuff plays an important role. Also, modalities like laser therapy helps to decrease the inflammation, increasing blood to the area, which promotes cellular healing. In addition to that, we also provide stretching and exercise that the patient can do at home. Now, if you went to a physical therapy facility, they would be doing them in the therapy center, so there's an advantage to that as well. But a lot of our patients, we give the exercises and they can do it at home to help rehab properly and also prevent further injury. So what happens eventually is that this joint wears away and you get bone on bone. And when this bone on bone occurs, there's a lot of friction, a lot of inflammation, decreased mobility. And like I said before, it's important that you help to manage it, not only by seeing somebody quickly, but also doing all the other things that we recommend, like putting the proper foods in your body, anti-inflammatory diet, proper stretching and exercising, also adjusting your ergonomics at your work or the things you like to do, your hobbies, taking frequent breaks. All these things add up to help managing and preventing or minimizing the development of osteoarthritis. So those are just the ways we reduce, the risk on the shoulder, how we prevent the osteoarthritis from occurring. Excuse me. But the biggest factor, like what I said before, is not ignoring it. If you're taking the proper care and you're addressing it, you're listening to your body, a lot of times this can heal properly without having it develop into more of an arthritic situation. Hopefully this helps. If you have any questions, shoot us a message, give us a call. Have a great day, and we'll talk to you next time.